Welcome back to the Positive Veterinary Dentistry Podcast, the podcast dedicated to helping veterinary professionals elevate patient care through better dentistry, better diagnostics, and better decision-making. I'm your host, Benita Altier, licensed veterinary technician specialist in dentistry, and the founder of Positive Dental Education. Today's episode is one I'm incredibly passionate about because it centers on a patient population that often needs us to be their strongest advocates, our senior dogs and cats. When it comes to dental care and aging pets, fear is often the driving force behind clinical decisions. Fear of anesthesia, fear of comorbidities, fear of complications, and fear that the procedure might simply be too much for an older patient. But postponing dental care doesn't stop dental disease progression. In many cases, it actually leads to more pain, infection, intensive treatment, longer anesthetic time, or even multiple procedures instead of one well-planned intervention. Today, we're going to unpack how veterinary professionals can approach senior pet dentistry thoughtfully, safely, and confidently without unnecessary risk while still prioritizing the quality of life for our patients. I'm joined by a veterinary dentist who is deeply passionate about advocating for senior pets and help teams move forward from fear-based decision to evidence-based care. So my guest today is Dr. Heidi Lobprise. She is a 1983 Texas A&M graduate. She became board certified in 1993 during 20 years of practice. After 10 years in industry and teaching, she returned back to dental specialty practice in 2014. Semi-retired. She is the author and co-author of 3 dental textbooks, and these have been books that I have definitely cherished and read through my journey of learning about veterinary dentistry through my credentialing process. She has written many chapters and articles and has lectured internationally as well as nationally. Through her passion for senior pet care, this has led her to release a new small animal senior care clinical companion to 5 Minute Veterinary Consult book. She contributed to the 2023 AAHA Senior Care Guidelines for dogs and cats and serves on the Grey Muzzle Advisory Board, which we're going to learn about later. So welcome to the podcast, Dr. Lobprise.
Well, thank you for inviting me. Yes, this is definitely one of my passions, maybe a second career. No.
Well, we were just talking about the fact that veterinary dentists often never retire, right? And it's hard to get away from something that you love, because I always feel veterinary medicine is actually something we get to do, not something we have to do. It's for the love of the animals that we want to continue on. So welcome. This is an exciting topic for me, and I know you as well. Before we get started, the last guest I had on this podcast left a question for you, and you get to ask a question at the end of this episode as well. So while we're talking, you can kind of think of a fun question you might want to ask the next veterinary dentist that I have on, or veterinary technician specialist like myself. So the question was left by Dr. Brenda Mulheron, and she wanted to know, if you did not decide to be a veterinarian or a veterinary dentist, what would you be when you grow up?
When I grow up. That's if I grow up.
If you grow up.
Yeah, if I grow up. Wow. So I'm kind of a numbers geek.
Okay.
So I'd probably have to do something with that, even on an OCD type level. So yeah, that's just something that possibly along those lines. Although professional crafts, Is that, can you do crafts professionally?
I think you could do anything professionally anymore these days, right?
Sell it on Etsy?
Yeah, absolutely.
Might not make much of a living. I think with a lot of us, when I was maybe 7, I've always had this love for animals, even though my parents really didn't. And I like what you say about there's so many stresses now, and so many veterinary professionals. I mean, let's face it, we have high suicide rates. Online reviews can be totally devastating. Things just aren't quite the same that they were when I first started, but every day I go in, I can make a difference. And that's what I hope people can keep as part of their, yes, this is a tough day, but you know what? Taking out all those teeth on that dog, he's going to feel better now. Those are the things you have to focus on the wins that we have all the time.
Yeah. And I think that we think we're in this business to help animals, but we also are helping people along the way. And this is another episode we could certainly talk about too, is the human-animal bond and how important veterinarians are to strengthening that, and how that really does help people with their mental health and well-being, and for us too as veterinary professionals. So sounds like you might have been a person that would have been a counselor for somebody or somehow been in a healing industry.
Possibly. I mean, yeah, I like doing the mission trips with Christian Vet Missions and doing things like that. So sharing
right.
that way. I like taking care. I like taking care of things.
Yeah, we're in the
So,
caring profession, right?
yes.
I love it. So yes, think about a question for the next guest as
Okay.
we go through this process here. You might come up with something in the meantime. So the first question I have for you, and this is really to help veterinary teams, veterinarians, technician assistants, receptionists, everyone on the team. When you hear the phrase senior pet dentistry, what are the most common fears or misconceptions you see among veterinary teams?
Well, I'll be honest with you. The phrase that just makes me clench. Oh, I was told he's too old for dentistry. Oh my gosh. Especially as I got down that rabbit hole with senior health, senior care. There's a strong concept. I even thought I had invented the word, but apparently people have been using it for people. Inflammaging. Presence of chronic inflammation impacts all body systems and the aging process itself. Increases morbidity and mortality in people. They try to find this inflammation. And as we start connecting the messages, a lot of times we talk about bacteria getting in the bloodstream and everything else. It's that presence of chronic inflammation. So like you were saying, getting good care throughout the life, but even as they get older, can not only improve their quality of life, I think it can we use the term health span too versus lifespan, even the number of years, especially those years in health. And when we're looking at these seniors, we were talking about our positive, things that make us feel great. Getting that little old dog, getting most of his teeth out, and 2 weeks later, he feels like a new dog again.
He's a puppy again.
Yeah. What if those patients never had to go through that chronic inflammation and infection and discomfort by good care throughout? And what if, yes, there's a lot of fear when it comes down to general anesthesia. But if we do take care of it in those late mature, early senior years, when those comorbidities are more manageable, then guess what? We can help the oral cavity, help the rest of the systemic health. So I think that's an important aspect of it. And seldom, I had one case recently that the Texas A&M cardiologist said this dog cannot be anesthetized. I think I've had 2 others in my career where the cardiologist said, you can't anesthetize this patient. Everybody else, we do good diagnostics, good exams, find out their health status, any other diseases, and with good management, sometimes postponing the procedure if we have to get them stable, good anesthesia and analgesia protocols, we can really minimize those risks. And I like talking about how the benefits almost throughout outweigh the risks.
Yeah, I love that. And while age itself is not a diagnosis per se, right? How does that mind shift really affect our clinical decision making if we aren't just focused on they're too old for dentistry?
Yeah. And as you say, age isn't a disease, but aging is a distinct process that affects all of us. I mean, we then have to realize, okay, good evaluation of that patient. And then as we look at going forward with the procedure, the reserves to heal, to respond to things are depleted. The immune system is depleted. So yes, we do have to take special considerations for these patients. And as we look at them though, like I said, getting rid of that. In people, if the inflammation is up, they look at diet, exercise, etc. 2 horrible words. But what is one area that we can almost completely get rid of all the inflammation in one setting? The oral cavity. Yeah, absolutely. That's why when we get rid of these horrible teeth and everything else, they feel so much better.
I agree. That's why I love dentistry so much, is because there's very few conditions in veterinary medicine that you can do an intervention and make them feel almost immediately better. So.
Absolutely. I mean, it's not dog ears or cat diabetes.
Yeah, those chronic conditions, we can't make them go away and cure them, but we could certainly cure them, hopefully, of some pretty significant inflammaging, as you said, and dental disease that they've been suffering with unchecked for potentially years. Yeah. So definitely, I feel like that whole idea is so important for veterinary professionals to embrace, because veterinary professionals, sometimes we're our own worst enemy when it comes to to actually being advocates for these patients, whether they're young or they're middle-aged or they're aging. We really hesitate sometimes to want to anesthetize patients ourselves. We certainly don't want to have the risks outweigh the benefits ever. But like you said, 2 patients in all the years that we got to the point where we are just not comfortable anesthetizing them, and all of the other patients that you were able to help. It's just amazing how impactful that can be on so many patients' lives, and then their owners too, really having that pet in their life for longer, hopefully, or at least the pet has a more happy life while we have them in our lives, right? And that's what I really think is important.
So there are times that, they are pretty risky, but the dental disease is significant, that it's interfering with their quality of life. And I've had the discussion with the owners that, yes, we're at greater risk. And I can't guarantee anything, but something has to be done. If I'm willing to take the risk, are you willing to take the risk? And there have been times with pets with other issues that I think the owners almost hope that the decision will be made during the procedure.
Yeah.
Because they've been debating in euthanasia and different things, quality of life with this pet. And when they come out doing great, they're kind of going, oh, okay.
They survived it, right? And they're
yeah.
like, I didn't expect that out.
Yeah, absolutely. And we even had one severe cardiac case, but he had partially avulsed part of the mandible.
Oh, wow.
And it was one that if this pet made it, we would be very pleased. We were paying CRI of Alfaxin and just did everything as quickly as we could. He did great.
Awesome.
So, yes, there are risks. Have there been incidents? Absolutely. There's going to be some incidences. And one thing I would really like to stress, especially with these senior pets, is when we look at morbidity, mortality studies done around anesthetized events, there are more issues in the recovery period than during the procedure itself, because we're so keyed in on them every 5 minutes, getting, all that monitoring during the procedure. Their body temperature is so important. Continuing fluids, that once they're swallowing or having a little cough, then their monitoring tends to decrease quite a bit. We may still have some connection with them and whatnot. There's even a new wireless device called Guardian that you can use.
Really excited to learn more about that
Yes.
because, that technology could be really helpful, because we're always limited on the number of staff that we have in our practices. And that limitation could potentially compromise patient safety, especially because, as you mentioned, when things often go wrong is during that recovery period when no one is monitoring them and they're not hooked up to a monitor. I think that's super exciting. And I'd love to link that in our show notes so that others can go learn about that.
Guardian. And it's by Zomedica, I believe. And there's some monitors you can use too, but it usually involves putting a pinchy thing on their toe or something like that. Wires. This does it wireless, and it transmits the TPR to a smart device or a screen on the device itself. So monitoring, and even afterwards, in the next few weeks, if that was borderline kidney issue, we need to make sure everything's going well. And we can talk about monitoring diabetes too. It's very important, because sometimes their diabetes gets better after you take out the bad teeth.
Yeah. Their insulin needs might be different, right?
Yeah. So I've gone on tangents on you, so we'll get back to that.
Oh, no, this is perfect. And it was segueing into the next thing I was going to ask about. Our senior patients, our older patients, often having concurrent diseases like kidney disease, heart disease, endocrine disorders. How do you, as a veterinary dentist, evaluate whether a patient is appropriate for anesthesia for a dental procedure? Is there just even a short little checklist that you might go through in order to determine if this patient needs even more intensive workup prior to anesthesia, or potentially maybe it's actually one of those very, very few patients that you actually wouldn't feel comfortable anesthetizing based on what you've looked at with their health?
Right. So probably the most common thing we need to make sure is evaluated, stabilized, is going to be cardiac issues. And if we do have a patient that has a recent murmur or recently increased murmur, not a lot of cardiological evaluation, I want a minimum of a pro-BNP, which we can do at the clinic. BioNote has one, Zomedica has one. There's lots of good ones right now. And thoracic rads read by a radiologist And you can put in there looking at anesthesia, please, give me the evaluation. If either of those two are abnormal, then we require an echo, again, read by a radiologist. And you can have an echo done, then have a cardiology review with the understanding we're looking at anesthesia. If those are too abnormal, then they may need medication, stabilize, and we'll usually do it a minimum of a month, and then reevaluation before we do it. But so many times, even with a murmur, there's no decompensation yet. All right. There's no congestive heart failure. If there's some mild enlargement of the heart, but nothing else looks severe, then what we do is we just adjust our protocols. Certainly with most seniors, we're going to be decreasing our doses of our pre-medicants anyway, and trying to minimize how much propofol or alfaxin. And the cardiac patients we're going to use do it very slowly. And they even might change our fluid rates, things like this. So we can adjust according to what we see with that patient specifically. With renal patients, again, it depends on how severe it is, but not just the severity at that time. I like to look at the history of renal function with that patient. That's why sometimes when they want to do blood work the day they come to me, and I've never seen them before, I get a little anxious. I'd rather have their referring veterinarian do it. And then I like seeing the trends. We now have SDMA and the FGF that will help us evaluate these, especially looking at the phosphorus levels. That's something. And the one thing I'd love to see more often in general practice, blood pressure measurement. I mean, we're not great at doing it.
And that's been talked about, I swear, Heidi, for 20 years.
Absolutely.
And when we think about blood pressure, I feel that it is such an underutilized thing, especially in routine examinations and also preoperatively before we ever put that patient under anesthesia. I'm so glad that you emphasized that today. And it's something that most people have the capability in their hospital to do. It's just not in the protocols that people are thinking about. This is something we do with every patient every time at this appropriate spot in the episode or examination or what have you. And yes, of course, the animal could be stressed or nervous. And that's why we need serial information. And like you said, with the blood work, I as well never want us to approach a case where we are in a rush. And dentistry, I think, especially for our older patients, this just didn't happen yesterday. Most likely it's been a buildup of years and years of potential neglect on getting under anesthesia and addressing it. And so we don't necessarily need to be in a rush, which could put these patients in more risky situations if we are trying to get the blood work the morning of, and we don't have serial blood works to look at from their previous veterinarians or years past.
Right. It's important so you can see the whole picture, So if they do have some kidney issues, we like to make sure they're well hydrated. So that may mean coming in a day or two ahead of time and getting fluids to make sure that the urine is not too concentrated. Of course, if it's renal, it might be less concentrated, but we want to make sure that they have good renal output and that they are well hydrated. Diabetics can be a little bit interesting, and managing those, we talk about different levels of where their glucose is to, I'm okay with a small amount of food about 4 hours before, and maybe 6 to 10 hours on brachycephalics that might have regurg. But there's good guidelines with AAHA that, and basically by the time they leave home, come to the clinic, get the exam, and even if they're first up, it's going to be close to that 4-hour span. With diabetic cats and dogs also, I stole this from a technician at one of my talks. They use lifestyle monitor, and they get that put on. Now, if we can get it put on prior to the procedure, that's great. So they'll know how much insulin to give, how much food, etc. But we can also do serial testings more easily during the procedure. And then post-operatively, this really helps to make sure that the diabetic animal is getting enough food for the insulin it's getting. And remember, we talked about sometimes you have to cut back on the insulin once a dental disease is under control, because periodontal disease and diabetes feed off each other. We know this very well from the human world, that chronic inflammation. I've even had some practitioners tell me their cats no longer needed insulin. They could manage it with diet and medication after the mouth was clean.
Absolutely. And using technology and these tools, we have really a lot at our disposal to be able to really appreciate their general wellness picture or health picture long before we actually decide to get them on the table and induce them for an anesthetic event, right?
Right. And another thing that goes along with the comorbidities is we really focus on what do we need to be giving prior to the procedure? Is there anything we need to withhold? So as we look at most medications, about the only thing I tend to have people withhold now are any antihypertensive drugs for 24 to 48 hours prior to. We don't want the blood pressure getting too low. With the exception, there's a newer study, cats on amlodipine, they will continue to get their doses that they need. But anything else, benazepril, things like that, ACEIs, we will discontinue for 24 to 48 hours ahead of time. Sometimes that just means not giving that morning dose, all right? But every other medication, pretty much we encourage them getting on the regular schedule. And this really is important for anxiolytic drugs. Senior pets, now I know you probably heard of the DISHA for cognitive disease. The A in DISHA now has 2 A's. They've separated out anxiety because they found out that senior pets actually can have increased anxiety levels.
Okay.
This could be due to their cognitive, their vision and hearing, whatnot. But give the gabapentin, give the trazodone, give it the night before, give it the morning of. This is not going to impact blood pressure that much, other than maybe keeping it in a more normal range. And in fact, anxiety can increase the pain system. So by making them less anxious, we can usually use lower anesthetics and they'll be less painful too. So it's really good to consider all these pre-medicants. When we can, we'll make sure they go home with a dose of meropitant that they get the night before. We can give the injection that day. We use it on all of our surgical patients. On a big dog, that's really expensive stuff. So we like dispensing the oral if they can. And also, especially with any brachycephalic dog that has a predisposition to regurgitation. We know those medications, meropitant, even the antiemetic drugs, don't stop regurgitation. And we're not going to stop it necessarily, but we'll put them on anti-medication for 3 to 4 days ahead of time. So if there is regurgitation, it's not as acidic. We'll still rinse it out and look at everything, but it really can help with that. And that's another thing we watch very closely with these older patients in the recovery phase too. So we focus a lot of operative things as well as post-operative things.
Absolutely. I think that's really important. And this is the kind of thing that I think our listeners are really looking for, because it cannot just be the fear of the client worried that their pet is going to go under anesthesia, but it really is the fear of the veterinary professionals that something could go wrong while the pet is under, and their lives are in our hands at that point. Yeah. We want to be as educated on what the latest and the best ideas are when it comes to dealing with these stones that do have, some complicating factors for sure, but it doesn't necessarily mean that we can't address the elephant in the room or the major inflammation and infection that's inside their mouths, really decreasing their quality of life. So I love that. Are there any situations where you think delaying dentistry truly makes sense? Or do you think most delays really will increase their long-term risk because they're not getting any younger, right?
Correct. Yeah. No, none of us are. So I would say if there's newly diagnosed or increases in the levels of cardiac disease, renal disease, probably most importantly, especially if, there's been a murmur, but the dogs had been doing okay, but we start looking at maybe that pro-BNP is increased, or the radiographs, or that echo is now showing maybe a level B2 on our cardiac, maybe up to C. And at that stage, I want to get that patient on medication if they have never been on medication, or adjust the medication to where they are more stabilized and they're not in congestive heart failure. That's probably the most common area that will change things. Blood pressure, because that can have an impact pulmonary, systemic, whatnot, if it's recently diagnosed, which means you have to take the blood pressure, right? And we're treating for that. Again, stabilization with that. Also, if there's been a recent increase in the renal dysfunction, maybe acute kidney injury on top of chronic renal failure, then we need to make sure they are under control, more stable. There's a stress. Anytime we go under anesthesia, I usually joke, most people's blood pressure goes up, right? When they go to the dentist, not mine.
White coat syndrome, they say, right?
Mike has their spa things. We get hot wax on our hands, a lavender warm neck thing. Yeah.
I want to come to your dentist when I go to Texas.
Oh, yeah. But our pets, even if this is where, individuals, their blood pressure, their perfusion is usually going to decrease. Okay. And even if with good monitoring, the blood pressure seems okay, everything else, I still get a little anxious about length of procedure as well. So with us, particularly in general practice, doing stage procedures with our senior pet, really watching their blood pressure and their body temperature is an important thing that I am completely okay with those procedures being split, getting the cleaning done, getting the x-rays taken, maybe those few that's going to fall out during dental cleaning, FODC, fell out during cleaning. But then if there's that broken upper fourth premolar or a discolored lower canine, doing the surgical oral surgery at a later date, decreasing the total length of time in one sitting, I think can be very beneficial for senior patients and us.
Yeah, because, it's not just the patient's time under anesthesia, but it's also the surgeons and the team's efficiency. And I've definitely observed the longer procedures go on, the diminishing returns that happen in regards to efficiency because of our mental and physical fatigue, because dentistry is definitely a challenging sport. I was just going to ask, one of the biggest concerns for veterinary teams is how you balance this thorough care or a higher level of care with anesthetic efficiency. So do you have any specific things that you are doing that make you particularly efficient, or how you would balance your high level of dental care against the time that it takes to do it right?
Yeah. So, and this is interesting because in talking in a roundtable with extraction, someone who was at the university level, they get all the teeth cleaned completely before anything else is done. And, they have 6-7 hour procedures. I mean, that's university. We understand this. I work with Vanessa. She is the reason Vanessa. I'm still working right now. Yeah. And after we get the patient stabilized and the monitor set up, she takes the radiographs. Amen. I look at the radiographs, and if I'm extracting 16 teeth, she's not going to be doing a thorough cleaning on those 16 teeth. I want to minimize the time under anesthesia. It's kind of funny. Yesterday, we had a dog we've been evaluating that has had for a bad TMJ joint, has been showing a lot of discomfort. In fact, we could barely do an oral exam because he's just so painful. And we get in there and we start seeing massive amounts of ulceration and proliferation like a chronic ulcerative dog.
Oh, wow.
And we had talked to her about, we knew the teeth needed some care. We talked to her about doing extractions before we go and do TMJ surgery. And I'm almost convinced that this dog, after doing full mouth extractions, may not need TMJ surgery. Wow. It may have been oral pain. Well, we still may need to go there, but oh my goodness. So we really need to go into these things. I had not planned on quite that long. Luckily, I'm a little bit faster than some. But if you do get into those cases, I mean, how many times don't say, it looks like it's just going to be a cleaning. Never say that out loud.
Yeah,
never
say that out loud.
Because you're going to find things on radiographs. That's why we always make sure we can call our owners during the procedure for the update on the treatment plan estimate. And as we're looking at that, you might find that upper fourth abscess tooth or that non-vital canine tooth, but you have the 4 procedures that day and your 2 o'clock's already there. Prepare your team and your clients for the possibility of doing those stage procedures. With my older patients, and I've talked with Sheila Robertson about this, an anesthetist, both with positioning and everything else. I am a lateral person. I'm not a dorsal and ventral person, which be a little bit careful with, how their joints are with these older guys too. 2 to 2.5 hours is a comfort range for me. All right. If we're getting that 2-hour mark, and other than doing root canals with crown preps, things like that. But if you're getting into that mark and you've got this oral surgery that you hadn't planned on anyway, absolutely appropriate to stage that procedure. I usually wait 2 to 4 weeks to do it. Occasionally, if I have really bad bone on the mandible and I've got to take out both canine teeth, we'll stage those. So I only do one at a time, make sure everything's going to heal right. But I think staging the procedure is beneficial for the senior patient, but also, like you said, the team. Absolutely.
Yeah. Now, I know what we did in my hospital, but I'm curious about what you recommend doing. How do you overcome the client's fear of the pet being anesthetized twice? Because just once seems too much for many people, not only emotionally concerns about their pet's well-being under anesthetic, but also the hit to their credit card or their wallet. Do you have any strategies that have worked well for you to be able to help them, help their pet, and help you minimize the anesthetic time per procedure so that you're never keeping a pet under for 5 or 6 hours? Although I'm sure with some pets, that would be fine. It's just maybe not best for everyone involved, right?
Right. And they have shown studies, up to 6 hours stable, they're fine. I get anxious with my seniors. So we look at what the entire bill would be too, okay? And usually the number of hours is going to be similar in one setting or in 2 different settings. Most people do anesthesia by the hour, isoflurane, whatever. The blood work's already done. On the cost side, IV catheter, induction, your drugs there, that could possibly be used as a bundle, so to speak, but also the education, keeping a patient down that long. In fact, my older patients, I also mention them with people too, with the longer procedures. If there's been cognitive issues prior to, they could worsen afterwards. We know there's a stress on everything that's happening. On a lot of these senior pets, once they've had even the cleaning and a few of the extractions, they are so much more stable than they were at the beginning of the first procedure, that the risk is sometimes lessened for that second procedure. So most times, I don't do it often myself because as a referral, they're usually coming from a long distance anyway. And like I say, I'd get her done.
Yeah.
But hearing from general practices that as they approach it this way, they've actually had some pretty good buy-in. In fact, I've heard some practices, not just for seniors, but for all cases, they do the first thing, and that if they find the major issues, after the phase 1 SRP, everything else is the staged procedure. That way you have a much better idea of estimates as well.
Yeah, you have an educated understanding of what the treatment really is, because you do have the information that you need from your dental radiographs or other imaging and your clinical examination of the mouth and your experience so far working with the patient under anesthesia in regards to how they did. And exactly what you said is what we wound up doing in the practice that I worked at with some patients, not every patient, but we would paint the stage that we see a lot going on in this mouth. And we look for the red flags, and that's not tartar. We're looking for things like missing teeth with of extraction, things like red bleeding gums, bad breath, pain in the TMJ or reluctance to let us see inside the mouth very well. All those things where we think something more sinister is going on beneath the surface. We would tell the clients this is a 2-step procedure right from the get-go. And we would tell them that we like to do them 2, maybe 3 weeks apart. So we give them time to heal between procedures and see how they're doing. And then we tell them the first episode, we would definitely diagnose everything that we can find and then spend up to 2.5 hours making their pet feel better. And that's going to involve whatever we can do in that time frame, extraction wise, or other types of things that are tooth saving or whatnot. And then we charged them out for the whole procedure when they picked up that first day based on our time.
They have to come back.
Yeah. We leave it as a credit on their account so we can still run through the additional anesthetic monitoring and surgery time and all that stuff. But it's not like we're charging them more because we're doing it in 2 shorter procedures, but they've already paid too, so they don't have to get their credit card out again. And they're going to see how the pet did from the first episode, and they're going to realize, oh my gosh, you gave me a new dog. Like, he wants to play ball all the time, or he wants to go for more walks, and can you give me back the old dog because he was so much easier. He just liked to or the cat that's waking up at 4 a.m. now because he's hungry, because before he was not feeling so great and you didn't realize. So I feel like from my experience with that kind of thinking on our part, we're setting the client and the patient up for success. We're setting our teams up for success too, because we're not blowing the whole schedule with, suddenly now this patient's turning into a 4-hour patient. We only put 2.5 hours in the schedule for them, or turning dentistry into a marathon, which is what veterinarian and veterinary teams have generally done over the years, because we're so afraid they won't come back. And we're just going to have to going, because if we don't, this poor animal is not going to get the treatment that they need.
Yeah.
So I hope more teams take your advice and my experience and what's worked well and try to figure out some strategies to make that better, because especially with these older patients, I'm going to be on Veterinary Anesthesia Nerds podcast talking about hypothermia, because I don't think people take that seriously enough, and especially with dentistry cases. And you mentioned with the senior patients how important that is. Explain to me some things that really concern you about patients getting cold while they're under anesthesia for dentistry specifically.
Okay. And especially with the senior pets, thermal regulation is not as robust as it used to be. Particularly, little digression here, we always talk about body condition score, right? Muscle condition score in seniors is so critical, because there is a natural loss of muscle as we get older, sarcopenia. If it's really bad, it may look like a fat cat, but if you can feel all the spine and it's cachexia, something's not good, all right? So those combinations, hypothermia can be a real issue with our senior pets. They're going to wake up more slowly. They're going to heal more slowly. It's very important to keep their body temperature within a reasonable range. And I usually, most of the articles and whatnot talk about 98. Starts to up and below that, we get a little bit anxious. So we like good body warming systems. I became pretty fond of the hot dog. Okay. And we've got another one now that's pretty good, but we have little kid socks that we put on their feet. We can put, we've got these, I used to use them when we used to go motorcycle riding, on the head. I can't even remember what they're called, but we put
like
that on the,
like a shower cap for the pet, right? It's like a cap.
Really watch how wet the face stays. I am a big flusher. I like to flush out a lot of things, but we change out the towels. There are some special mats that will let water go through. They're not great about letting blood and teeth go through, though. I found that out.
Right.
And monitoring that temperature is going to be an important thing. Again, not just during surgery, but post-operative. The other thing we like to do with seniors, I mentioned using lower doses as we can. Unless there's a severe cardiac issue, we'll even use small doses of dexdomitor, because it smooths things out. I can reverse it. I can reverse hydro. I can reverse midazolam with flumazenil. And we do that on a regular basis with our senior pets as they're starting to wake up. So they will become more functional more quickly. And, using as little as we can get by with. We mentioned we do all the blocks, so they're less painful, so we can keep the gas anesthetic as low as possible. I kind of joke, just before they come off the table, but looking at the eyes, looking at the jaw tone, things like that, and monitoring them closely throughout, again, those trends. And big discussion. We have a student that is watching with Vanessa these days. And the first thing, when the blood pressure doesn't seem well, first that's good on one side, not on another. Cats, heaven forbid it's going to be good. You palpate the pulse, okay? Or you get out the old-fashioned Doppler and you do that. Because my adage, what's the best monitor?
The one that you will use, right?
A good technician.
Oh, a good technician. Okay.
Yes.
Yeah. Well, use your technician, right?
Because you're going to be using all the mechanical ones, all the fancy ones, and that's great. I'm not going to be paying attention to that, but actually looking at making sure the temperature is not in poop. Feeling that pulse, that femoral pulse, has it changed? And all those things. And if we do have any considerations, we've got our list of medications we can use. We printed out for each patient based on their weight. It's an Excel spreadsheet, including our emergency drugs already calculated. If we have any issue, we stop doing the mouth things and we work on the life things. So being prepared is key, and really good monitoring, even in the recovery period.
I love that. I love that you mentioned the Doppler, because the Doppler is actually one of my favorite devices. And I was using it constantly on the dentistry patients because I found it rather comforting just to hear their pulse. Mm-hmm. And as we're listening, as we're working, if there is any significant change in the tone or the rhythm or anything, like it's so obvious because that Doppler is literally attached over the pedal artery, and I'm just listening. And I feel like that's one of those pieces of equipment that a lot of people have just put away in the cup somewhere and they don't actually use them anymore. I did find that was very helpful to the team to have that as an extra tool. And these are just tools. And like you said, with the temperature, if you're not even monitoring it continuously or at some sort of interval, how would you know if the patient is trending towards a body temperature that's unsafe?
I like keeping the stethoscope. And Vanessa just got one of those fancy new ones that just really, really cool. Even though they're hooked up to an EKG and everything, and tidal CO2, we still keep the stethoscope around to listen from time to time, to listen to heart, to listen to the lungs, you know?
Yeah, and having well-trained technical team, somebody that's on that patient to keep them safe while you're doing the work that you need to do is absolutely critical, right?
There's even anesthesia services that you can sign on for to get consultations for specific patients on medications to give, things like that. So there's very few reasons not to do dentistry in those senior pets.
I agree. Along the lines of things that you do to keep the patient from losing body temperature, I'm curious, do you use suction during your procedures at all to minimize the water spray or the water flow around the patient's head?
So my current situation is a little pretty much general practice level. I'm not going to get a lot of new equipment, so I'm a little jealous of what some other people have. Suction is definitely a good idea to try to get rid of all that. But if you have to make sure you change them out regularly, etc. We also have a fluid warmer that we use. We looked into the air warmer with the inhaled, but usually that's not too much of an issue. I'd be concerned about dried out passages, whatnot. But yeah, just keep warm.
Yeah, absolutely. And it sounds like suction would be something that more veterinary hospitals should really consider. And they may already have suction in their clinic. They're just not realizing how helpful that could be for dentistry cases to keep that patient from getting cold via water, pulling the body temperature, the heat away from the patient's body. So, but there's other low-tech things that we can do, like mentioned. So I think all those things are super important.
I mean, tin foil.
Right? We used to use bubble wrap actually on the patients that were under anesthesia for cataract surgeries and things, and talk about senior pets and things that they often have to do with their teeth or their eyes. Those cases anesthetically were very nerve-wracking cases, but one thing we definitely were working towards is not letting them become hypothermic.
Right.
Wonderful. Thank you so much for that. So going back to the client communication and patient advocacy, what do you say to the clients to help them understand that their pet's going to be safe in our hands, or that we're minimizing anesthetic risk, so that maybe veterinarians could take some scripts from what you might tell a client so that they could then emulate you and be the Heidi in the practice and be able to feel more confident in how they're educating the client?
Excellent. So to begin with, I love the term advocate. We use it with our senior parents and our senior relatives, talking about how we can be that conduit to make sure that the patient gets the best care and it's understood how to give the best care. So part of it is talking through the points we've talked about today. Let's get good preoperative evaluation. If we see any specific issues, we're going to address those to minimize the anesthetic risks. We use that SA chart 1 to 5. We're going to see a lot of 2s. We're going to see an occasional 3. If you have that 3 plus, maybe you consider a referral. And depending on what your comfort level is too. To begin with, anytime you're approached with an advanced case, anesthetic risk, and you offer the referral, that's always an option. I hate to sound, if the owner decides not to take the referral, make sure you document it. Then if something occurs, you have that in your records, okay? Always consider offering the referral. But once we have a patient that is relatively stable with those preoperative medications that we talked about, including anxiolytics, meropitant, anti-acid type medications, and then communication during the day, all right? So we triage our patients. Sometimes we get some from long distances, so we have to go with them first, or some of those patients that need the owner there with the muzzle before we can give the injection.
It's an all-day project for some patients, right? Because of their fear fears and just behavioral concerns that we're trying
Oh,
to
yeah.
minimize any kind of stress they're under.
Yes. But usually our senior patients are higher up on the list for time frame. And then we make sure we call them. Fluffy's getting her pre-anesthetic right now. She's resting comfortably. She's doing well. We're going to call you during the procedure with updates. They love those updates. There may be one or two. I'm going to be in a meeting. Text me. Fine. That works out good. And then we call them once they're in recovery, give the update. Let's go ahead and plan on discharge at such and such a time. I think talking them through all the steps we do, talking about the monitoring, talking about how the technicians monitor these patients, talking about the warming systems. I mean, I've always said that the hot dog system, they're quite speciesist because we use it on cats too. Talk about the tinfoil or the baby socks or whatever. And they'll see the level of care that you have for these patients. And I think even getting a testimonial from one of your other clients, I was really concerned about anesthesia, even concerned about the cost, but we finally decided to, even if it makes our decision for us, we need to get this done for quality of life. And oh my gosh, he's like a new dog. We're just so excited. Of course, those clients, anytime anything is going wrong, then they think it's the teeth. Oh, he stopped eating. It's got to be his teeth. But having them hear it from another pet parent can sometimes be really helpful.
I love that because I think that a lot of clients feel like they're alone and that their pet's the only pet that's had to deal with this type of thing. And they're the only client that's had to pay that much money to have their pet go under anesthesia. And they just don't realize that this is something we do every day. And alleviating the client's fears really is making them feel like they're a part of the team.
Yes.
We're all on the same team here and we are advocating together for your pet. And this is how we make this as safe as possible, mitigating any kind of risks that we can, but then also being aware of the risks that we can't, right? And knowing that we are here to communicate with you as effectively as possible. And that's our intention. And we really want to make sure that you are in the loop. We're not making decisions without your consent. And so back to our original discussion about how we want to quickly get things diagnosed and not be spinning our wheels, cleaning teeth that need to be extracted, and really getting that treatment plan solidified as fast as possible so that we can then focus our attention on what's really important, especially for our aging pets. And that has really, I felt, served us well in the practice that I worked in for 19 years. We really got a lot of compliance because, one, I felt like we were trying to be strong communicators and educators of the clients. And two, we were coming from a place of trust with the clients, and they then wanted to do what we were asking because they trusted us. And that, I feel, is a communication issue. If people don't trust you, that somehow there's some sort of disconnect in the communication and trying to communicate while they're under anesthesia. I know that I have experienced teams being very reluctant to call clients while the pet's under anesthesia because they think it might take too much time, or they're just focused on the patient. They don't want to have to stop and focus on the client. But I feel like sometimes that's where we go wrong. And then clients get upset with us because we haven't done that communication to the point that they feel heard and seen and feel like their pet's safe in our hands.
And you have the perfect out if you have one of those really talkative clients. You say, well, I've got to get back now.
Exactly. We usually would have the technician or somebody on the technical team start the conversation.
Yes.
And then we would just have the vet come in and say the part they needed to say. And then they would say, well, I'm going to give it back to Benita because she's going to go over the rest of it with you, but I need to get back to your pet now. And it always worked just fine. It's not like you have to stay on the phone with the client for 15 minutes and wind up having the pet be delayed in care. But I think that communication piece is so important, and that the vet actually does see the patient's owner at some point during the day, because sometimes they see the technical team, they check in the patient, they don't actually ever see the veterinarian, or maybe at least the veterinarian could call them once the procedure is done and give them an update over the phone, even if they're not going to be available when the patient is going to be discharged from the hospital. So yeah, those are really, I think, things that a lot of hospitals might want to take care of. And then we want them to do it again. And we're talking about aging pets today, but even aging pets may need to have a procedure again in 6 months or in a year or whatever, because they're hopefully going to need some maintenance of care, not just one and done type of thing. And it's not because now they're 15, that's the last procedure they're ever going to get. The oldest cat I ever knew in person was a 27-year-old orange female cat, 27. And I just know our pets are living longer because we are taking better care of them. And part of that, I feel, is dentistry. But we do have to anticipate that due to technology, medicine, research, us advocating for these patients, that hopefully they will have longer lives, but we do want to make them happier as well, right?
Yes. Health span, not just lifespan.
Health span. I love
health
that.
span. That's the period of relatively good health before
we get to say goodbye.
Before they get critical.
Right? Yeah, exactly.
Minimize that bad part.
Yeah, for sure. So key takeaways, I think understanding the health span and the inflammaging, I love that. Is there anything else that you'd really like the listener to take away from today's conversation? Any practical steps a veterinary team could implement immediately? The pearl of wisdom that we like to leave people with.
Well, I like how you were talking about the trust for the owner to the vet team, but also they need their own trust and their confidence. So if they don't have that due to skills or equipment, you can always improve on that. But the key is it is a team sport. Working as a team to get those senior pets in for better care takes a good conversation with everybody. And probably the best practical portion of it is take the radiographs first. Absolutely.
I agree. Yeah, I've been taking dental radiographs since 2001 first. And I always tell people I have never said, darn, I wish I wouldn't have done that. Never. Yeah. I have delayed them because the patient's not ready because of pain management issues and things. Yeah. But I have never regretted getting those images first. And I feel like that's something that we keep needing to tell teams because there has been misinformation out there over the years that you can't take dental x-rays if you don't clean the teeth first. And unfortunately, that's delaying the progression of getting the client communicated with and making sure that we focus on what's important, which to me is making the pet feel better. It's not about cleaning their teeth. It's about making them feel better, and finding all the painful things is how you do that, right?
And you know where to put the blocks right away too.
Yeah. We'll get our blocks on board as soon as possible. Sometimes even before we take the x-rays, of course, if we know.
Sometimes.
But you do have to give those blocks time to work, and delaying that could potentially delay the surgery and potentially make the patient stay under anesthesia longer. And we talked about things today specific to anesthesia because that's always a big topic when it comes to any patient, whether they're aging or not. And the time they're under anesthesia is a key component in that. So I love that. So did you happen to think of a question that you'd like to leave for the next person?
Yes. What is the most unusual patient you've had in veterinary dentistry?
I love it. Okay. And it could be unusual as far as the breed or species, or it could be unusual in regards to what you found when you got in there, right?
Yes.
Yes. I love it. That's so good. Thank you so much, Dr. Lobprise. I just adore you, and I loved your happy disposition and your smiling face when it comes to everything that you do, and just really bringing these veterinary teams such good information. And I feel like really super practical information. I definitely want teams to be able to take away some things from our conversation today that really they can just do or try. And sometimes trying new things is scary. Sometimes not just going back into your happy place of what you've been doing for the last 20 years is scary. But I think we do need to embrace new concepts. And I applaud you for that because you've been in veterinary medicine for a long time. But you aren't
really.
Yeah, well, a long time is relative to whatever. But I think that you aren't just stagnating, right? You are really thinking about what's new, what's next. Before I leave you, I would like you to tell us a little bit about this book. Where can people go to read more about aging pets and specifically dental care with the 5 Minute Consult book that you have just participated in, and a little bit maybe about the Grey Muzzle group too?
Yeah. So 5 Minute Veterinary Consult, the big book, I call it. I do help edit the dental section in there. We have both the small animal dentistry clinical companion, but this year came out 2025. Sorry, now it's 2026. The senior pet care Clinical Companion, which was a labor of love and really got me looking down, like I said, that rabbit hole of all the aging things, aging, inflammation, frailty. And oh my gosh, there are drugs that we're getting in dogs first because they're a good model that help to increase that health span, lifespan. So the science that's coming up with all of that senior care stuff is absolutely amazing. So be on the watch for it. And then greymuzzle.org, and I'll give you the link to that. It's an organization that raises money, okay? So they're just a fundraising organization. And then they accept grant proposals from different entities, shelters, things like that, that help the healthcare of senior pets and adopting senior pets. And it is really an amazing group. They've gone over $1 million in fundraising the last couple of years. And it's just, you need to get on board with it. Check them out. And they have a lot of good sugar face pictures. I love those sugar faces.
That's excellent. Well, those are two amazing things. So I will definitely link in the show notes where to go to find more information on all of these things, because I feel like we want to know more about this topic and things that you're passionate about, I'm passionate about as well. So I want to help the listeners learn more about these organizations so that they can help as well. Also, if you are available, people in your area still could come to you for veterinary dentistry. What city and what is the name of your clinic?
We're outside of San Antonio in Bernie, Texas, RNE, and it's Cibolo Creek Veterinary Hospital. But you better hurry. We're going to be taking consultations through October and procedures through December 2026, and that's it.
Yeah, Dr. Lobprise is going to retire one of these days to green pastures and having fun. I know you've been such a resource in Texas over all these years for a lot of veterinary clinics, and I know they're going to really miss you a lot as far as having you take care of these animals when they feel that it's a bit over their heads or they just need to have that extra friend. But I know you're not leaving the whole idea of helping people with veterinary dentistry and senior and aging pets. We will definitely be watching for anything you're doing in the future and keep an eye out for you.
Excellent.
Senior pets deserve comfort, dignity, and relief from pain regardless of their age. When we delay dental care out of fear, we often unintentionally increase their risk. But with thoughtful planning, strong team communication, and evidence-based decision-making, we can provide safe, effective dental care that dramatically improve their quality of life for aging dogs and cats. Thank you so much for joining me today and Dr. Heidi Lobprise on Positive Veterinary Dentistry Podcast. If this episode resonated with you, please share it with your team and keep advocating for those senior smiles. Keep doing positive dentistry, and you can find us on social media and anywhere you listen to podcasts.